Welcome, everybody. Thank you for joining us. I'm Angelica Sadar, the NRBS Executive Director. We have several folks from NRBS with us. Beth Baral is here. She's one of our longtime board members. Ronnie, who is the brains behind the whole organization, is here. And I'm sure she's helped all of you. I want to make a couple of announcements. Our NRBS conference is November 1st through 3rd. It's going to be in Philadelphia at a beautiful location, actually in the middle of an arboretum at a retreat center, close to the airport. It's virtual and in person. We kick off Friday, November 3rd in the afternoon, Eastern Time, with Jay Gunkelman. And from there, Saturday and Sunday, we're going to cover a wide variety of topics to help you enhance your skills. We'll put the link in the chat. In honor of Nesta, who has supported NRBS over many years, all of today's registrants are going to receive a special offer. If you register for the conference, you also receive a free NRBS CE series package. Those CEs are APA and BCIA approved, and there's 8 for 2024 that will run through December, I think. And you have until December 2025 to complete them to get all your CEs. And there are 9 from 2023. Those you got to finish this month if you want to get CEs for them. All right. Again, we'll put that all in the chat so that you can find things. I want to direct you to the podcast, Healthy Brain, Happy Body. Dr. Saul Rosenthal, another one of our board members, has collected a nice group of podcasts now with a lot of variety of presenters. So those are the announcements. Mike does want to take questions as we go along, so a little bit different from our usual format. So feel free to raise your hand or put questions in the chat as we go along. I first met Mike Cohen in 2002 when he was the Director of Education for EEG Spectrum. He continues to be someone I turn to when I need a colleague to consult with. His journey into learning about the brain began way before that in 1996. And since then, he's worked with literally thousands of students and many, many more adults and children as clients. He frequently takes on the most difficult cases, and they are referred to him directly from physicians, mental health practitioners, and also other neurofeedback practitioners refer to him as a consult. Mike's approach is to look beyond the diagnosis or condition and help identify the constellation of factors that contribute to the problem, and that goes beyond one single discipline in most cases. And he has a wide network of folks that he uses to work with. He says it's like putting a jigsaw puzzle together that nobody's figured out yet. And he is relentless in figuring it out. In recent years, he's considerably expanded his ability to help people. He's added a diverse and comprehensive constellation of investigative tools and tactics, in addition to biofeedback and neurofeedback. We'll be hearing about some of them today. In his spare time, he wrote the book Neurofeedback 101, Rewiring the Brain for Anxiety, ADHD, Depression, and Beyond. And it's a great book. We just have it in our waiting room. It's designed to explain neurofeedback to the layperson and how neurofeedback can help them. Okay, as I said, Mike seeks solutions using a multidisciplinary approach, and today he will give an overview of how adding gut-brain therapy enhances your practice and benefits your patient.
Great. Thank you, Angie.
Take it away. Thanks, Mike.
I really appreciate it. And I probably need to turn off phones, but I won't worry about that. Everybody pretty much already knows what gut-brain is, but I spend a lot of time with clients thinking about it, and have learned over the years a lot more about it, with just enough to make, does anybody know enough about the gut-brain connection? Probably not. So anyway, Angie's already introduced me, so I'm going to skip all that. If you go do a quick search on PubMed, NIH, for anxiety and microbiome, so literally this was this morning, I just did a quick search, and here are a few of the studies. I mean, there's just tons of studies on anxiety and the microbiome. If you type in depression in the microbiome, if you type in depression and inflammation in the microbiome, here's a few more studies, but there are tons of them. So even clients, if you say, have you ever heard of the gut-brain connection? Most clients will actually say, oh yeah, I've heard something about that. So the question is, a client comes in and they're dealing with mental health or sleep or other issues. Are we dealing with their brain, or are we dealing with their gut? Or are we dealing with both? So I, at this point, assume we're dealing with both. And so if I only do neurofeedback, then I'm not helping tackle a big piece of the puzzle. And it's certainly a puzzle. So I've learned to cultivate good resources and referral sources for some of this kind of stuff. But sometimes it's too much to send a highly anxious patient off to a whole nother doctor to start looking at some of this stuff. So I often start to introduce it, step by step. In addition to microbiome stuff, things that affect the microbiome and the brain that you may or may not be aware of. Hopefully you're aware of it, but I actually try to put it into practice. I live in Florida. Half the houses have some kind of mold issue. Now, not everybody is as sensitive to mold as others, but, we just had a 12-year-old, 13-year-old, two girls from same family, one with super high OCD that's really been spiking over the last couple of years. The other girl is just kind of general anxiety over the last 3 years. And, it just seemed too strange. They were both having these escalating symptoms. And I started talking about the house. And I said, you got to go check to see, at least rule out mold, because Florida has lots of it, but it can occur in any location. I'm hearing people from Arizona tell me in California, which is really dry, they have mold issues because there's leaky pipes and there's leaky things that you don't even know. So I'm just mentioning mold because in these cases, turns out they had mold big time. And I have learned that if I do neurofeedback with people who are in active mold, it often does not go well, or it might help, but it doesn't stick. If I do other kinds of things, it doesn't stick. And so that kind of thing, if they're sleeping with their phone under their pillow or right near them, does that affect anxiety? Does that affect sleep? Does that affect mood? Yes, it does. Do many people talk about it? They don't. And I'm not going to spend much time on this, but I'm just trying to point out, when I talk about looking at the microbiome, I look at the microbiome and I look at other factors that might be impacting my client's health. And this blue light night exposure and lack of quality light day exposure, 2 weeks ago, I would have probably not had that on my slide, but I just heard an incredibly deep dive podcast, because I listened to a lot, from a brilliant, actually neurosurgeon who's really looking at the role of light in energy. So we have lots of kids who have low energy. That can be mood, that be poor motivation, that can end up actually being anxiety. Well, they're getting blue light exposure, from what time? From the evening, as long as they have their screens on, they're probably getting blue light exposure. Every light that you have in your house, unless they're old incandescent bulbs, are blue light exposure. That diminishes dopamine. I didn't know that until last weekend. Blue light exposure diminishes dopamine, and it affects melatonin. So, and all these things affect sleep and anxiety and mood. So I can't just talk about microbiome without talking about all the other factors, but I'm kind of telling you where I'm coming from. And I provide, I could make some of these available if people are interested, I could send some emails. I have several different emails for most of these topics that I send out to clients once we've had a consult, started to engage them. And I tried not to overwhelm them, which is a constant challenge. So probably overwhelming everybody else. I also have learned to I talk about blood sugar a lot, because it turns out that blood sugar has a huge role in affecting anxiety. And this is really, again, microbiome. It's gut oriented. So I came across several talks by this woman named Jessie, young French biochemist who, had a lot of anxiety and depression as she's growing up and really ended up having to figure this stuff out. But she has some great online stuff, and actually the younger crowd will listen to her. She's got a nice Instagram account, and so that makes it a little more easy to talk to them about it. And so these are things for you to explore. I'm not going to try to go down each of these paths other than to say all of these things affect the microbiome. There are supplements, there's Jessie talks about apple cider vinegar, about how to eat a breakfast that helps downregulate your blood sugar. Berberine is a supplement that, if you don't know about it, helps regulate blood sugar. I have a lot of my anxiety people starting to use things like this, and there's a whole bunch more, and I'm not going to try to cover all the possible supplements because there are a number that can help stabilize blood sugar and that can play a role in how this all works. But I just find all of these things, these are all related really to microbiome. I mean, your brain and your gut talk to each other, and your gut is where a significant amount of your dopamine and your serotonin are driven from gut to brain. So, 70 to 80%, depending upon who you hear, of serotonin and dopamine kind of starts in the gut. Anybody here that blue light exposure, I don't know if I already said this, downregulates dopamine. So again, I'm going to repeat that one because how many kids are having the problem of motivation and mood and everything from lack of dopamine, and are seeking out, supplements that help upregulate their dopamine because they've got blue light all night long. This driving these issues. So, there are various foods and, from probiotics to prebiotics. If you don't know these things, fine, and you're not wanting to research them, find good resources in your surrounding area. There's always people out there who specialize in this. So we probably limit things. Like we have this vitamin called Hardy Daily Essentials I've been using now over 12 years. That's really good for anxiety and mood and often helps sleep. And I call it a brain multivitamin. Just a really good brain multivitamin. It actually has some independent research, so that was the basis for it, using it. And I started this before I really understood the whole microbiome thing. So now as I watch and see people improve with it, it seems fairly clear to me it must be affecting the microbiome, given the way people sometimes improve. But, I can't say that that's for sure. I can just say, I'm looking for ways to help people feel better. And if I know the microbiome is involved, so anything I can do with the gut, and I probably didn't put diet here, but diet is probably number one, number two, and number three on all this. There's greatly emerging research on ultra-processed foods and mental health disorders. So hopefully, if you haven't, there's a Harvard, I believe it's a Harvard psychiatrist who's put out a book and some YouTubes on that subject. So if you don't know that work, you should go check it out. You can find this stuff very easily just by doing some searches. SPM, you ever heard of SPM? Pro-resolving mediators. Why do I bring that up? It helps reduce inflammation in the gut. it helps to reduce inflammation in the brain. Do we have kids and adults that are dealing with inflammatory processes in their gut and brain? This is part of the microbiome issue. It is said, again, the percentage varies depending upon who you hear, 70 to 80% of inflammation starts in the gut. You've heard of gut permeability, okay, leaky gut. So probably everybody's heard of leaky gut. Have you heard the term leaky gut, leaky brain? So if somebody has leaky gut, there is a very high likelihood, I didn't try to pull research on this, that there is some blood-brain barrier integrity issues that are also going on, contributed by that. So all these things are, how do I point people to things for them to consider doing without completely overwhelming the family or the person or the individual? I mean, that's the dance of how to coach them on this stuff is really hard. I mean, I can tell people that the research on sauerkraut is actually better than probiotics in terms of repopulating your gut, but the percentage of people who want to hear that is extremely low. People don't like sauerkraut. Probiotics. We have a really good probiotic. We use one called Megaspore Biotic. Some nice research base for that. We recommend it because it's convenient for clients. We tell people, you can order this online. We don't care, but you may want to do something to help support your gut. And we've been through about 10 different probiotics, and a lot of them kicked things up a little bit for our anxious patients. And, I remember one patient coming back with one of our better new probiotics that really worked well, who said, this is from the devil. And that was because it kicked up some stuff. If you have a really screwed up microbiome, you got a lot of good guys and bad guys, and you start making those good guys work harder, they're going to fight the bad guys and might not always feel better. So we've learned that the Megaspore Biotic seems to be gentler and hasn't triggered any of our high anxiety people. And so it's a good basic, but again, we're very cautious about how we introduce this. If somebody has any chance of SIBO, you shouldn't even be talking. I mean, if they have a complex gut set of issues when you're doing your intakes, we don't even recommend. We just try to refer them, because a lot of people just don't realize that their gut is playing a role in their anxiety, in their sleep, in their depression issues. And even though they know something about it, they're just not clear about that. So, there's mold testing that people can do. So we sometimes recommend that. There are gut tests. Okay. So do you go to a doctor to get a gut microbiome test? Often, functional medicine doctors do this kind of thing. You can actually order Biome yourself to look at, and several others to look at what's going on in your gut. Do I have too much of one thing and too much of another? And I can look and see if that might be helpful. So do I ever recommend that? Probably not. I mean, I used to. I never really translated a lot of these microbiome tests into great success. I mean, we're looking for, how do you make people feel better in a relatively short period, in a reasonable length of time? And I am confident these gut microbiome tests do help, but you better find a really knowledgeable person to help guide you on how to use them. And often I haven't seen them work. There's a new test, and I put this up here. There's a really great podcast from an excellent MD that does this interview. So you can find this on YouTube. Kara Fitzgerald, great interviewer, really sharp MD. And this is a little blood test that you can take to help figure out metabolites as a result of how your gut processes things. And when you get that, and I actually did one myself, I was pretty darn impressed. Got to talk to the people. They consult with you on what all this stuff means. And it really guides a lot of people at what in their gut is contributing to some of their mental health issues. So that's what all these things are supposed to do. But this is a relatively simple test that people can take. And I would just suggest you might want to listen to the interview, because that will really explain that kind of thing. So we do recommend that sometimes to our clients, not that everybody does these things. Those are all examples of things that we're looking for to give hints to clients on other factors that they can enlist, so that our core tools, which for a long time for me was neurofeedback, we can add to it, because we have a much more complex picture of problems, and we want to help the client look at it from multiple angles. Many clinicians I know around the country and even around the world all talk about everybody's more complex than ever with, the problems that we're seeing from anxiety and sleep and depression and lots of other things. People are coming in more desperate, and they want help, no matter how complex they are. They just want help. So in addition to neurofeedback, which I'm really not going to focus on because I've done that for years, I'm assuming many of you have done those things. It's a very powerful set of tools, but with these complex clients, do I need more? Yes. I mean, do they need more? Yes. So I started doing bioregulation therapy maybe 10 years ago. I'm not sure. I was probably the first in neurofeedback to start that technology, just because it seemed like, it was the first kind of discussion of gut brain that I had at that point in terms of what else could I do. I really didn't have a ton of tools at that point. And, we were already talking about some, but this just gave me something that made me understand, there might be a tool. We target the brain with neurofeedback, and the brain often impacts the gut. Can I do something that helps improve the signaling from the gut to the brain? So bioregulation therapy does that, helps with that. And I'm going to spend time talking about that. In addition to that, we are using more photobiomodulation type tools, whether that's V-Light or NeuroRadiant from Neuronics. Those are also tools that seem to be other adjuncts to the challenge that we face. They're not necessarily gut brain, but they are additional tools. And then one that is, specifically gut brain that we're relatively recent at is vagus nerve, and a vagus nerve stimulator. We use one from Hulist that you put up against your neck here. It's very simple. We've gone through about 5 different units, and it can really calm down some of the anxiety. And what we think of as vagus nerve is really gut brain. And so I view it more like, right now, I view it more like electronic meds. Like, can I, instead of taking a Xanax or Klonopin, can I put something up against my neck and calm things down? It's a small piece of a bigger picture, so you need a more comprehensive approach, but sometimes you need a quick fix for people with high anxiety or panic attacks, or just can't bring themselves down. And so this is a relatively inexpensive tool that we've started using, although I will say we're early in it, and I don't have as much data on it for clients across the board, but some of our clients really like it as just something that helps. BRT really had, the bioregulation therapy really changed our practice more than anything else, because we have a bunch of different ways to do neurofeedback. So, I've got at least 5 different neurofeedback systems. I use a variety of different approaches to neurofeedback, and that's core of what we do. But we've got lots of people with, I'm going to really talk about the somatic part of these lists of items. So, sleep is really just complex. You need to, if somebody's got complex sleep problems, you gotta hit them with the kitchen sink and try them with a whole bunch of things. It is, I think sleep disorders is the most complex issue that we're facing, and it so contributes to depression, anxiety, and everything else. Even when people, say, "Oh no, I have," I just talked to two unbelievably anxious clients whose sleep is god awful, and I remind them, you cannot not have anxiety if you sleep totally crappy. And they're like, "Oh no, I have plenty of reasons for all my anxiety, and that's what causes me not to sleep." We all know you need to be able to sleep. BRT is a really nice tool to help support that, along with neurofeedback, so that you're tackling both from the brain to gut to brain. There are a lot of inflammation issues that are driving mental health. So I don't know how much you've seen. I showed you some of the studies on when you type in inflammation and depression. There's a lot of emerging research about the connection between depression and inflammation, certainly at least some certain population. I don't know how broad that is. I haven't studied the literature that carefully, but we have found that BRT is particularly good. It's seeming to help support downregulating inflammation. Now, is that because it's affecting the gut and helps calming that down, or are there other factors coming into play? I don't really know, but I can tell you when you have inflammation with chronic pain, with injuries, but also with anxiety or people who complain of gut issues, the BRT is just a powerful tool to help settle some of that down. And we're not a pain center, but we definitely have people who come in with pain because some of our anxiety and depression and ADHD clients, learn, hey, we have something for pain. Everybody knows somebody that has pain. Everybody does, or at least every other person does. And this is the most remarkable tool for pain that I've seen, but I'm not really going to focus on that aspect. I have done some other talks on pain and BRT. So what is it? Basically, it is one of the tools that we use is called CellCalm. So this is bioregulation therapy that covers several different tools that they have, but they all fit into a category of basically bioresonance, bioregulation therapy. What are the field effects of the body? So we all have these complex electromagnetic fields. It's not like we're just GSR and that's the only measurement. There are complex signaling that goes across from cell to cell, that our cells have to all be talking to each other, just like in our brain. We need good coherence, good neuronal communication for us to be functioning well. You need the same in your body. You need your cells to be communicating well because that allows them to function better. This device and these devices, both PMF, and I'm going to separate out a little bit PMF and the CellCalm, which I view really more, we call it the body biofeedback because it's really much more of a biofeedback device rather than a pulse magnetic field device, which is what PMF stands for. And this helps the cells work better. So that's the bottom line. And there's if you start trying to do research, it's very hard to do research on this, but if you dig deeper into what's going on, even with the microbiome work, even with the EEG work, if you start looking into stem cells, by the way, and exosomes and peptides, you start hearing a whole lot more about initiating improvements in signaling in the nervous system. So all those things have in common, stem cells, exosomes, peptides, and gut to brain kind of issues, and really even neurofeedback. Everything is signaling. How does signaling in the body works? And so the bioelectrical side of CellCalm is that we're basically going to help make signaling work better. That's my bottom line way of thinking it. And there's more and more. Actually, when I first got into this, there was less information. And now we're hearing all this signaling things when you start thinking about I talked to a very top expert in stem cells related to concussions, okay? Because I had some concussion clients that were wondering, should they be doing stem cells? And there was a discussion, wouldn't stem cells do better if you added PMF? Because PMF is initiating that, it's known to increase cell signaling. Stem cells is supposed to add some greater amount of signaling in different areas of the brain. And so if you combine them together, won't it work better? But there's no published research on that particular thing that I just described. So I'm going to talk about one of their devices, which is Cellcom, which is kind of a core tool that we use. Then I'm going to talk about a PA, and this is what we call our body biofeedback machine, meaning it's biofeedback. And then I'm going to talk about pulse magnetic fields. And then I'll talk about how do I decide when am I going to do neurofeedback, when am I going to do body biofeedback, when am I going to do both. And, I may not say, okay, and I'm also doing a light helmet for, which might be the photobiomodulation. I also may be throwing vagus nerve in there. We mix a whole bunch of things to help people who have complex issues. Can you see this sensor right here? Okay, so there's a sensor on the screen. That's a gold-plated sensor. I don't know if you can see. I'm holding one up here real quick. But so this device, you use somewhere between 4 to 6 sensors that you put on. So some of those sensors are measuring the electromagnetic fields of your body, broad spectrum electromagnetic fields of your body. So the example I really give is this, okay? You're listening to an orchestra, and that orchestra has a whole lot of different sounds and music from all different kinds of instruments. We put these 2 really expensive microphones in front of that orchestra, and it captures the whole dynamic range of sound from all different sorts. So these sensors are literally picking up, like a really expensive microphone, broad spectrum electromagnetic signals from the body and from cell signaling. And it measures that. And when you use that microphone and you capture that information, it transmits that into an amplifier. And if you're listening to, if you're doing that in front of an orchestra, it goes through an amplifier, and out on the other end comes an orchestra, even though it's just going through a box like this box that's right here. It looks a little bit like an amplifier, a music amplifier. It's a body signaling amplifier, and out comes an orchestra. But in this case, as a biofeedback device, we're not changing the music. We're not changing your signals. It's feeding back certain components of the signals, just like with neurofeedback, you're feeding back certain signaling. So I'm going to feed back beta, or I'm going to feed back alpha. In this case, I'm going to feed back, just like I have this broad set of signals, I'm going to send back the flutes. I'm going to send back certain frequencies. And your body, so there are 2 sensors that allow you to take that information back into your body. You don't hear it because you don't actually hear your cells signaling each other. By the way, if you pay attention, can you feel your cells signaling each other right now? I don't think any of you probably can do that. But we're not going to notice changes in our cell signaling until later, when we see how the body responds to taking in that signaling. So we have the sensors like we see here that capture the information, and then 2 of the sensors, actually the one on the left wrist is one that brings back information to the body. There's a back pad behind this woman that is also sending some signaling back, and then you might have 4 to 5 sensors on your body that are picking up things from your heart, which is a key large energy part of your body, your gut, which is, again, where am I going to pick up the most signals? Sometimes for the brain, I'll put it over the temples. Sometimes we'll put it at other locations. We're dealing with pain, we'll put it over the pain areas. But all this is capture the signals, biofeedback, simple biofeedback. Capture all these signals, run it through this box, and there are a number of programs that allow it to say, okay, this is going to help with certain kind of neck pain. This is going to help in calming calming down somebody who's agitated. I mean, there's just a ton of different programs. And unlike neurofeedback, where you have to figure out which frequencies we're going to send back, there are programs that are already kind of pre-programmed as to how I'm going to send it back. And you don't have to, I don't look at all the data. I just look at which of these programs are going to have them make the most sense. I do a shorter version of that when I'm talking to clients, by the way. I mean, it measures what's going on in your body, and then it plays it back. But instead of playing back all the sounds of the orchestra, it might play the flutes, it might play the clarinets, whatever. And that's actually they kind of seem to get it. You can either lie or sit. So we actually allow both in our office, a chair and massage table. The sessions, again, are typically 20 to 50 minutes. There are variations to that, but that's typical. And we have them while they're sitting there. It's a passive process. It's not an active process, because you really are not feeling how your signals are both being measured as well as being communicated back to your body. So you're just sitting there. It is, how does it feel while you're doing it? If I have sensitives, like really sensitive to their body, I have people who can tell me in 1 minute or less, oh, I'm noticing something happening. I'm noticing shifts. I'm noticing tingling, and I notice my gut feeling something or some other place. If you're someone like me who's a little more dense and doesn't notice their body so much, I don't notice a thing when I'm doing it, but I notice later, particularly if I mess up my hip or do it for something that I have some other issues with, I will notice later, because you're really getting signaling that's saying, okay, I'm going to help your body signal better. I'm going to help cells and tissues talk to each other better so they can detox more. I mean, in other words, when your cells are working better, you detox better. So you sometimes do have to warn people about what a detox is, because sometimes if you do a fair amount, somebody can experience some detox symptoms because literally their body's able to start to detox itself. I mean, I had one woman that said she went to the restroom for the first time in a long time, really strongly because of it, but that's not necessarily typical. It's just there's other ways people detox. And but you have people who are much more delayed responders, but I don't think that's any different than neurofeedback. You got people who are instant responders, and you have people who are delayed responders. I have people, really the first time that they run a session, I'm often saying, I want to know what happens 3 or 4 days out, because that is often more of what I see than just immediate. Although I also have people who have some immediate effects. We just had a 3-year-old with severe tics that had come on over about a 4-month period. And after one session of the Cellcom, her tics went away about an hour after she left, and didn't seem to come back for about 3 months, actually. As I said, you're not going to capture the data and look and try to analyze body signaling. It's just beyond what this system does, but it does have a bunch of different predefined programs. So I'm just going to pick out a few to point out. There was an autism study, so there's a bunch of different programs that, like, this is, if you're working with an autistic kid, program number 1, program number 2, program number 3. I'm not going to try to teach you this, but I've actually loved how this has evolved over the last 10 years, because if I get somebody with anxiety, and they have a lot of somatic symptoms. Okay. So a lot of my anxiety people have somatic symptoms. So I want to add this in because this is going to have a big impact on that. So I can come in and I can use a standard program for anxiety. It says add to current. There's actually a series of different programs that are included in this that I'm not going to try to explain, but there's all, from how is electrosmog affecting you, to neurosis in the stomach, to vegetative dystonia just means, are you edgy and nervous, and are you is your body all tense? low energy, vitality, or mood. Low energy and mood, vitality is actually a really great program. So these are all predefined. It's the learning curve on this is far, far less than neurofeedback. It's really a night and day thing because of all these preset programs. And I've talked to a number of people who've gotten started with this over the last couple of years who really were able to use basic programs that they found already set up as their starting point without, like, here's, one for extreme tiredness. Here's a program for emotional balancing. So there's many different kinds of programs that exist, mood programs, pain programs. So not going to try to go that far into explaining it other than it's relatively straightforward, and you then hit the download button's not showing up as blue because I don't have it connected to the machine. But if it was connected to the machine, literally all I'd have to do is, okay, I put an anxiety program in here. I would click download, and then there's a button that says start, and you start. So it's not hard for people to learn to do. I'm just talking in general about how we use this. I do want to mention a few other things that we have found BRT to be exceptionally good for. I mean, any client that has somatic symptoms, I'm thinking about, do I include BRT? Now, I may be also thinking about using neurofeedback, so I'll talk about that a little bit more later. But I have been doing neurofeedback a very long time, and on occasion, I set somebody off in a way that they are not doing optimally after their neurofeedback session. Probably none of you have ever experienced that, but I'm not good enough to be consistently perfect with neurofeedback. And I got tricky clients, and on occasion, I set somebody off. And so we learned that when I set somebody off, and I didn't want to try to figure it out with neurofeedback because sometimes trying to balance that isn't always easy or perfect, that if I put them on BRT, I could almost always smooth them out. So we would have these really short BRT sessions, like 5 minutes, 10 minutes after a session for some of my most tricky kids, sometimes tricky adults, sometimes trauma adults. I mean, different kinds of people, but people who were just really, really, really hard with neurofeedback to get them comfortable as they left or they're not quite right. And the BRT was just a great tool. I mean, when we had time to put them in there, it's been really helpful. You're going to have a certain number of clients that, in addition to their anxiety and depression, some of their underlying issues are either more autoimmune. I mean, a lot of gut clients that have gut issues also may have autoimmune kind of issues of a variety of sorts. I mean, we're not talking about arthritis here, but we're talking, just people who have been to every doctor and nobody knows what to do with them. BRT is like my go-to in just terms of helping get them settled down. That doesn't mean it's going to solve all these people's problems, but if we can help them feel more comfortable and we can help them get through the day better, we can start to build on that, and we do. I've already mentioned pain clients. Obviously, some of those have anxiety and mood issues, et cetera, and sleep issues for sure. BRT is one of the best pain tools. It just is. The thing that I don't get to talk about enough, and it does definitely relate to anxiety and sleep and mood issues, is how many people are on meds, potentially the wrong meds, or they've been on meds too long and the meds really aren't working, and you got to help. I mean, they would like to come off the meds. They may have tried to come off meds multiple times. So I just had a guy that, when I mentioned that his Seroquel that he's been on for 20 years is probably increasing his slow EEG. So this 49-year-old who had a 7.5 hertz dominant alpha frequency because he's been on Seroquel and one other med for 20 years. Nobody ever changed it. It's pretty high dose. And there's a very high likelihood that medication is slowing his brain down in a not good way. So how is he going to come off that? Well, neurofeedback is very helpful for that. supplements are helpful for that. Microbiome, actually, meds screw up your microbiome. So you're going to need support for the microbiome. But the BRT is I'll tell you, is my go-to for helping people as a core tool get people off meds. And once you start to learn how to use that, it's just a powerful tool. I mean, you have to obviously be careful. You're going to be working. I mean, you're going to have an MD that's coordinating, any kind of coming off of meds, but adding BRT to that, I remember the first time I had a woman that had tried, 5 or 6 times in her life to come off her SSRIs, and she was probably 40. I mean, she had crash and burn experiences every time she just tried to make a minor change to her meds. And she came in, we only did a BRT. We actually did not even do neurofeedback. I kind of have a sandwich protocol of timing of how to use the BRT when you're trying to come off meds. So I think I won't try to tackle that right now unless there's interest later. But she came off those meds for the first time. I mean, she came off those meds on a, titrating basis, no bump, virtually no bumps or very, very limited bumps and a pretty smooth experience. And so since then, that was an early case. We've had a number of people that we've been able to help do that. It's more and more clear that, you work with people, whether you're talking heroin or Suboxone or, any other, benzos or other things that are, those were other kind of drugs, but this can be a really, really good tool. And there's special components to the way BRT can be used to particularly target substances. That can be cigarettes also. So there's new tools within the BRT that seem to speed up that process or make that process a little more potent in terms of helping manage coming off those substances or the meds. I mean, in a way, the substances and the meds are the same. They're just different ways to take things, but it can be alcohol. It can be anything. This is just a really, really good tool for getting the gut and the brain involved in that.
Excuse me, Mike. You've got about 8 minutes left, and there's a couple of questions in the chat. I don't know if you want to open things up to questions. I'm happy to read them to you, or you could take a look at them.
If you would just read them to me real quick, that would be great.
Yeah, yep. Okay, we'll do the easy ones. How is this billed to insurance, and do they cover? I'm going to recommend that we hold off on that because that's by state provider, and I want to focus on some things pertinent to the training.
But it is you can use a biofeedback code for it. Mm-hmm. So the question is, are there other ways people would tackle that, just like with neurofeedback? So yeah, more complex.
Question. Yeah. How many sessions before you see results, and how long do the effects last?
So I typically tell my clients that if I don't see some progress at what we're targeting within 4 to 5 sessions, we need to reassess, either take a completely different approach to using the BRT, because it certainly can take longer than 5 sessions for things to kick in. But my experience is that most clients, we're saying 80%, notice definite clinical effects within 4 to 5 sessions, even long-term chronic pain clients who are very, very tricky. So that's more of my approach. And then in terms of how long does it hold, okay, I have a stenosis client. If people know what stenosis is, very, very challenging, painful narrowing of your spinal cord on the nerves, and it very hard to treat, although there are some surgical treatments now. And had a guy who's 48 who's an ex-plumber, and we have done over time probably 25 sessions of BRT. He has not been back to us in months and months. And actually, he came in with his kids because we're seeing them for ADD, and he's like, I'm doing great. So whether that's panic attacks, whether that's anxiety, whether that's other things, it has the potential to hold equally to neurofeedback, and even if anything, a little faster in terms of how fewer sessions to have a bigger effect at times. But if you've got microbiome issues and you're not doing anything about them, if you're eating crappy, if you're eating processed foods and all those other things, all bets are off.
Right, as well. They can't just expect us to have the golden solution. There was a question about specific question, but more generally, can you address how you work with TBI?
So I just missed a really great talk on TBI and CellCom. I have used BRT with a number of TBI cases as in conjunction with neurofeedback. And so I'm just going to make a general comment. When I do both, for many of them, it is a better solution. We make more progress, but can I sort out which contributes to what? I've certainly had people who just was doing neuro. I added in the BRT. We did better, and vice versa. They came in because of brain injury or concussion, because of pain, but they also had a bunch of cognitive or anxiety, other issues. So we added neuro. So my experience is combo for that kind of client is your best approach.
Thanks. In relationship to fasting, have you done any, just clinical comparisons or seen any studies that show the effectiveness of BRT compared to fasting? Kind of ties in with what you just said.
Well, and can they clarify fasting here for a second? There's lots of different ways to define fasting.
Generally speaking, the question was, the precursor was fasting has been shown to improve cell signaling and cell detox.
So there's something called Prolon, which is fast mimicking diet. There is intermittent fasting. There's longer term fast. So we often are encouraging strategies for including those type of fasting strategies along with BRT, because you will speed up the process, and the healing process will actually occur faster if they clean up their act, so to speak. So if you look at fasting as a way to improve the digestive system and, clear out the system, the combination is going to be way better than just one side or the other.
Yep. Again, everybody's got to do their part. How about MS?
So there are some MS protocols in here. I must admit that we probably only had 3 MS patients come because we don't, that's just not a target for us. Mm-hmm. All 3 had clinical benefits, like, now I'm walking up steps and I couldn't walk up steps. But none of them stuck of the ones, they were distant, they were financial issues, other things. So I don't know, Tarul, do you have any comment on that?
Yes, I do. We do have cases that we have been able to help MS patients, especially with their stability and movement. So if anybody's interested, I'm happy to share some information. You can put your name in the chat and we can send you some information about that. And there are specific protocols for MS in the system.
Yeah, I think, Tarul, there's a couple of questions that come in that generally now are just kind of asking for neurological, physiological, disorders. So I think the answer would be the same, but I want to pose it to you.
Correct, because the CellCom works in a very similar way. It may be called MS or something similar. We also work with Alzheimer and dementia patients as well. So there's a variety of protocols in that space that we work with.
I'm going to take 1 minute to just introduce something called the Nesta, which is a EMF pad, pulse magnet. So the fancy magnet, the really fancy magnet. This is the controller. It's actually quite small. Actually, if you can see me holding it up, I don't know if you can, but it's this device. And so this woman is holding a little thing in her hand. There's a back pad, which actually you can put it in the back, or you can just hold it on the front of you, so sometimes we do that. They have some different kind of programs, anxiety. The core programs are anxiety programs for like 30 minutes, depression 30 minutes, focus 30 minutes, electrosmog, which means, we're getting zapped by the world, kind of settle your body down. Energy balancing, I'm picking things that we use a lot. The sleep program, we use that a lot. So gut brain, everybody's got gut issues, by the way. Everybody in the United States has gut issues. So and you can pick which of these programs. So you can do 6 programs at a time, and then you can pick among that. Oh, see, it has Joyful, by the way. That's been a very popular program around here. People really like that one. So we often have people we started with doing this with people in our office while they're doing neurofeedback. Now my staff fights over it. We have to get another one because, this client absolutely needs this while they're doing the neurofeedback. And then now we're starting to have people, once they use it in our office, go, that they can take it home and rent it for a month. And really, you'd be amazed. We had 5 anxiety people came. We did a small anxiety study, and 3 days in a row, they came to do 30 minutes of anxiety on this pad. And 4 out of the 5 had significant clinical benefit from that.
Mike is at Center for Brain, Jupiter, Florida. Tarul, you all know how to get a hold of him. If you have trouble, reach us at NRBS. And these folks are here to help you. There's a ton of things they can do. So thank you so much for everything today. And thank you, everybody, for joining. We'll see you next time.
All right. Thank you, Angie and Tarul, and thank everybody for joining. And you're welcome to send questions to Tarul or email me if you want. And hi, Jeff.
Thank you, Mike.
All right. Thanks.